Hey folks, welcome back to the Change Physician Podcast. I'm your host, Dr. Kevin Cuccaro, with my co-host, Dr. Melissa Cady. And today we're talking to Dr. Taylor Brana. And Dr. Brana is going into his fourth year psychiatry residency, trained in Philadelphia, still in Philadelphia, started his Change Physician path pretty early on in his career. And we are going to understand why he has done what he's doing and how that has impacted both his medical training as well as his residency experiences and what he anticipates going into practice. So Dr. Brana, thank you so much for being here today.
I'm super excited to be on, and I'm glad to help out.
All right. So
awesome.
We want to focus on the journey here, and to start at the beginning, if you're going to want to start there, is why did you choose to go into medicine?
Well, if we really want to start in the beginning, it's going to be at Mills Hospital in California. I'm just kidding. Okay. So, yeah, so medicine in general. So just a little bit of background about me. From California, and I have a Russian Jewish household. And as part of my family's story, my grandfather was actually in the Soviet Union gymnastics team, and he was really into sports, and he did lots of stuff. So just early on, I grew up essentially really interested in athletics. There's photos of me with my grandpa stretching me and doing handstands when I'm 2 or 3 years old. So there's always that kind of part of our family story. And my brother and my sister put in other sports as well. But basically, as I went into middle school and high school, I started learning more about nutrition and exercise and fitness. And so I was naturally reading a lot about health. And then when I went into college, obviously, I wasn't sure exactly what I want to do, and I don't think anyone really does. I mean, I don't even 100% know what I want to do now. Have some more ideas, but so I thought a health field would be something more natural for me. I originally thought I was going to go into physical therapy, and then I decided to take the prereqs essentially for pre-med, and it was kind of on a whim decision, and I did well, and so I kind of went for it. And now that I'm in this position and part of the journey of going through this, I mean, I couldn't imagine have made a better decision. This, as we'll talk about, I'm sure being a physician offers you so many opportunities, and to be a leader is very important to me. And so that was kind of the natural fit once everything started rolling.
Yeah. So when you were going into pre-med and had this vision of this career, what was your original intention or belief that you were going to get out of this, or how did you envision your future in medicine?
The original vision was, again, I mean, I come from an immigrant family, so you might know this story well, but if you're not a doctor or a lawyer, you're not being very successful. So I definitely had a little bit of that kind of push in that journey. I didn't really know what exactly to predict. I thought that medicine was going to be, I originally had thought that, I'm going to be around a bunch of leaders. People are very invested in good health. I imagine people to be very positive and have good energy around them and carry themselves well, just because, again, you're around people that are interested in health. As we all know, when you enter healthcare, it doesn't really feel like that. So I was in for a rude awakening when it comes to what the real healthcare system can often feel like. And so, yeah, that image of what I thought was very different.
When did you feel that shift? When did you start noticing that things weren't what you thought they were going to be?
Yeah. So, as I alluded to before, I competed in gymnastics and I did D1 training. I competed at Temple University on the men's team, and I was probably at my peak in terms of, physical health, mental health, spiritual health. I just felt great. Life was good. Then I entered med school, and probably after the first year, I felt the least healthy I'd ever been. And in my head, I had this realization. I was I entered a system, nothing really has changed for me. I'm still the same person. And yet now I feel the least healthy I've been. This cannot be a health promoting system. And so I realized kind of within that first, maybe second year transition, I was there's something inherently wrong that going into healthcare, I can't be healthy. So that was kind of the shift for me initially. And then, we can talk about it more, but I just started to realize that there needs to be something else that's happening.
And I think that's an important thing to focus on, because we see that in so many physicians, right? People go in with an expectation of one thing when it comes to medicine. I would wager most of the people I've talked to, we do it for a lot of different reasons. The immigrant background, where it's the career, it's a stable career path. But I inherent with that, usually people go into healthcare is because we want to help people get better or well. And at some point, people start seeing again, just like you were saying, that the system doesn't facilitate that. So I would like to explore that a little bit more. What was that conflict like for you? What were your classmates doing? Mm-hmm. How were other people adjusting to this transition versus how you were adjusting? Could you just go a little bit more detail?
Yeah, sure. I would say the biggest conflict, going into that whole thing is, again, that dichotomy of going into a healthcare system and then I feel the least healthy I've ever been. And one of the struggles, of course, is you're going from, college where you're able to study most subjects pretty well into the fire hydrant, like information overflow of craziness that you need to know everything about everything. And so there is that sort of pressure you put on yourself. So one part of it is, of course, the adjustment and the sort of cultural shift where you feel like you have to know everything. And I think a lot of us were putting that pressure on ourselves, which isn't good. The other thing too, though, is the challenge of balancing the schedule that you have, right? So like when I think about my first year, there was 4 hours of didactics, there's a few hours of anatomy lab. And after those didactics, the didactics are just there to basically comb over these PowerPoints, but you don't go deep. And then, so you have to come home and then study more, and just to sort of keep up with all of that data and information and then be able to eventually pass the exams. It's just a lot. So as you guys, of course, know, and anyone listening would know, that if you go through this process, it's always studying and you're always sitting and you're always, you're always leaning forward. As DOs, we know you have your entire anterior chain is curled over, and then that weakens certain muscles in your body, right? So ultimately what's just going to happen is I had terrible back pain, like terrible back pain for me, meaning I had lower back pain just from sitting all day. It was much harder to find time to exercise. There's the mental stress of feeling this need to be perfect. And then all of a sudden you're getting like B's, or in some exams I'm getting C's, and I'm like, what the heck is going on here? Like, I've been doing well my whole career, and now I'm here and I feel like less than, right? So all of those pieces kind of contributed to that conflict. In terms of my classmates, the same thing. We were all trying to cram together, study together, push each other, but this constant struggle of needing to always be in the books, always study. There's a lack of balance that is just, it's not really possible unless you start to find some way of creating a routine, or find that discipline, or find a way to build in the things that are good for you. And that's a challenge.
So it seems like, and I'm sure, Dr. Cuccaro, you have probably a lot of things you can say related to pain and the multiple inputs that can contribute to that. And we won't get into that today, but obviously there were a lot of things in your environment and the setup of just how you had to construct your days that was not conducive to wellness, which is kind of the antithesis or the opposite of pain, a painful life. But I'm curious of all of those things that made you realize this is an oxymoron. This is like not the thing I thought medicine or, really health is all about. What was the plan or the thoughts that you had to maybe recreate your vision of your future because of that?
Yeah. I mean, so there's a couple of parts there. I mean, one part of it was while I was in it, I just wanted to quit. And I legitimately, by the way, probably would have if I didn't feel the need to finish, which unfortunately for me was the financial debt. And that's a huge part of it too, is once you're locked in after a year or 2 years, I mean, you're dealing with, 150, 200, 250. Some people have like 500 plus. How do you handle that level of debt without the ability to pay it off? And of course, as we know, physicians are a high paying position, and you have a huge delayed amount of gratification. once you become an attending, but what other field are you going to go into? So you're locked in. I've read articles about calling it the golden shackles, right? So that's one aspect of it was, you know, after that, I'm of course locked into this whole situation. But what was my vision going out of it? I realized the tighter it felt like I lacked autonomy to take control of the situation, the more I just wanted to break out and create my own freedom. So that's, and you know, to take a step back, I've always kind of been fairly creative. I've had lots of interest outside of just medicine. So that made me more and more look into what were going to be the opportunities to allow me to have a little bit more leeway, a little bit more free time, a little bit more pliability, so I could try to do other things such as what we're doing right now with podcasting. So that's what I try to do. And I reached out, and, you know, as we'll talk about with me starting my podcast journey, I started to reach out to see what were the actual options. What are the real options out there for not just physicians, but medical students, residents, and then attendings? What are the actual options besides feeling like everything's stuck and the system is burnt out and there's nothing we can do?
Yeah, I'm going to touch on that just a little bit more, just because medical school is not easy. It goes without saying, and it really isn't easy because of the lack of time. So what in the world made you want to start a podcast when you're in the middle of this process?
Yeah.
When, you know, as a, you know, whether it was an outlet or whether it was something that you could find a piece of control over or something, but why a podcast, and why when you were in the middle of medical school?
Yeah, so the idea came to me, I was thinking about it for a while. I've always wanted to do something a little bit more creative, but it came from a very natural response, which is I went on an internal medicine rotation, and I asked her what got her, the physician I was with, I asked her what got her excited about her field. You know, what do you love to do? What are you looking forward to? And then she basically answered, I'm looking forward to my 7 days off, because she had a 7 on, 7 off. So, and I'm reading all these articles about depression, about burnout, about exhaustion. So I had just entered my 3rd year, and the first response I get is I'm working with a burnt out physician. And now I'm thinking, crap, what did I get myself into? Because I'm coming off the 2nd year. I just took my step 1 exam, which as we all know, when you're studying for boards, it's a grueling process. It's also very isolating. And now the first doctor, who I think could be a great mentor, very knowledgeable, smart, and she's telling me she's done, right? So I wanted to flip that around in my head. I'm a big believer that, you know, you're as empowered as you believe yourself to be. And so I wanted to empower myself. I wanted to believe that there were options out there that maybe we didn't realize. So I took it upon myself. I started reaching out to mentors, doctors on like social media, people who I perceived, okay, I can't really tell, but who I perceived to be happy, who are energetic, who are excited. And I emailed them, I called them, I talked to them. I had like 2 or 3 conversations with different physicians. And I was so inspired by the conversations. I was like, this is a crime for me not to share this. Like, it felt like, you know, you have conversations with certain people and you feel so good. And you're like, I wish my entire class could have heard that. Like, I wish everyone could hear this moment and they could share that. And that's where the podcast comes in. As soon as you record it, you put it out there, and it was something that's fun. I feel like you just put out that positive energy. You get to learn from people. There's no downside. So there was a lot of fear involved, and it took me till my 4th year to actually put it out there. But that's kind of the impetus of the process.
No, that's great. And so before you actually started the podcast, then did you ever have those moments when you're like, oh my God, this is so great, and then run and talk to your classmates and say, I just talked to this person and they said this, this, and this?
To be honest, what I'm talking about is like the fear aspect of this. I didn't want to tell anyone about my podcast. I had zero desire to actually talk about it, which is a problem in and of itself in the culture, I think, a little bit. But I was nervous. I was nervous about what my classmates would think. I was nervous about what my residency selection would think. I was nervous how people might perceive it as me putting something out there as a med student, because, you know, if you think about the hierarchical structure, like, who am I as a med student to create a podcast? So all these sort of fear beliefs around that sort of were coming in. but I had some good mentors. I had people that said, Taylor, like 99% of the time, it's going to be awesome. And you are going to get the haters, you are going to get negativity, and that's fine. As you know, the biggest tip I got was, if you're putting authentic information out there, if you're not doing anything inherently illegal or releasing, you know, patient information, that stuff, and you're just having valuable conversation, who's like, what's gonna attack you? Yeah. And that's true. That was the case. I started putting things out. It's been well taken by individuals who've known me. It's been well taken by my residency, and has been something that a lot of, you know, people in my class have appreciated. And it's been a really great experience.
Nice. So you had made a comment earlier about this idea of, you know, trying to re-envision or maybe have other ideas of where this is going. What is your life kind of like right now with this podcast involvement and your other responsibilities, and where do you see, what's your vision from there?
Yeah. So the big thing I want to, you know, instill in this conversation, and what I'm learning is, and I hate to sound cheesy, but like, the sky really is the limit on what you can do in your life. And I think the more you believe that there's a linear path to how things are supposed to look, the more your life is going to close in, and the less you'll have that creative energy to start to maybe look at things a little bit differently. You know, there's something that I've sort of learned over time. I call it like essentially the compounding positive action flow. Like, there's a positive effect that happens when you believe in yourself enough to do something that aligns with what you'd like to do, that is your expression, something that no one else is telling you to do, something that you honestly just want to do for yourself. For me, that's podcasting. I get into flow. I'm like with you guys right now. I'm enjoying the heck out of this, right? There's something about doing this type of work, which is the combination of skill and what you love, right? So if you have passion and you're good at something, inherently in that process, you will connect with awesome people, you will create opportunities, and it will create this compounding effect. So why did I say all of that stuff? I said all that stuff because through this process, my future looks really limitless. I've met amazing people. I'm doing things I wouldn't imagine. I'm starting to build out businesses. I'm building out opportunities. I'm building out a course right now. I'm balancing that with my residency schedule, which actually with psychiatry is doable. There's really so many more things I can do now that I couldn't have realized unless I started the process of engaging and talking to great people. So
I just wanted to expand on part of what you had said about reaching out and meeting new people. I think that's a real critical thing that even Dr. Cuccaro and I have experienced, where it's like you don't want to give up on the idea that there's something better, and you have this kind of, whether you call it a calling or a feeling of just this sense, a need to connect with others so you don't feel alone, and you just reach out. I think that gives you such, I think it just allows you to expand your mind and not feel alone in the process. And it gets you excited about, you know, even just a new relationship with somebody that's doing something with their life in a different way. I commend you for that, because I think we need to have more physicians to be comfortable with this uncomfortable notion of reaching out to people you don't know. Yeah. I think we just have, there's something, it's like, you know, I've never been in the military, but you're kind of in the trenches, even if you're not side by side directly with them, you kind of know the grind. And I think there's a sense of compassion we have for other physicians that are struggling to find a different way and a better way to do things. So I just wanted to say that I think that's a big positive attribute that you have to be able to reach out in that way. And hopefully others will do that too. Kevin?
All right, so that's important for the listeners, because in this day and age of the internet and connectivity that we have, it is so much easier to reach out and connect with somebody than it's ever been before. And like you were saying, Melissa, is there's something specific about being a physician. I mean, there's a reason this is a podcast called The Changed Physician, is because unless you have the lived experience of being a physician, it is very, very difficult to understand this process. And so the listeners out there, you know, like what Dr. Brana was doing in the middle of medical school, which I absolutely applaud you. I couldn't, I was just trying to keep my head above water. I don't know how I would have been starting a podcast or doing anything else. And I certainly didn't have the foresight to kind of look beyond that at the time. But if you're struggling, reach out. And it's not that hard to find. There's a number of different physicians out there. Reach out and however, email them. Like it's amazing. People actually email you back like you wouldn't think they would, but they do. So that's fantastic. So,
and I want to say something, like, I don't want to sound like a superhuman when I did all that stuff in med school. There was a specific and most med schools have this, by the way, there's a specific section of 4th year where you've essentially finished your audition rotations, you've done your interviews, and there's like a lull, and a lot of people take lighter sort of, electives, and it's just a more relaxed time of the year. Most people go on vacation during that time. I got pretty obsessed with the whole podcast concept, so I learned like everything about it. I created like a team, created a system, and so that's why I was actually able to continue. Intern year was crazy, but I still kept up with it because I had formed that system before I entered residency. That's the only reason it was even possible to continue.
Yeah, I mean, a system that's a critical piece for I think any business, especially if you ever want to scale. I mean, having a system in place is important. But you learn that early, and so that's fantastic. Kevin, did you have something else before I jump on to that next question?
No, that was
okay.
There's always stuff we could talk about. Right?
Oh no, sure, absolutely. Well, knowing what you know now, what would you tell yourself as you entered medical school? Just trying to give yourself a better perspective.
Well, I think going into med school, I think the big thing I would have wanted to instill early, which I wish I'd learned, is getting a routine or a disciplined format of inputting healthy things into my day. I wish I had started to create those routines before med school. And for example, healthy things, good things for you are always going to be good things, but those obvious basic needs get laid on the wayside when you're stressed and burnt out and exhausted. So like basic things like coming up with meal plans beforehand, having like a good water bottle. I know it sounds simple, but it really is. Making sure I purchased a good mattress beforehand, getting the blackout curtains and blackout blinds in my room ahead of time. Thinking about, something that really helped me as I started to get better at it was morning workouts in med school, because that really got my energy up during the daytime. So I wish I had just implemented that. That would have, if I think about early med school, that would have been something that if I'd kept that routine, it would have let me handle the challenge of the day better. So that would be something I would tell myself.
It's the power of set routines. That's definitely a good thing to do. All right. Well, thank you so much for coming on today, Dr. Brana. And for the listeners out there, if you could only recommend, I'm going to say a book, but it's really one sort of resource, one thing that is significantly an impact on how you see your career path and what allowed you to sort of change your physician life, what would that book or resource be?
I can't honestly, I won't answer that the right way, but I would say as a principle, and I talked about this with one of my business partners yesterday, Neil Desai, shout out to Neil, is infinite curiosity. I truly believe you will never, ever, ever not learn. And it is absolutely all about infinite curiosity. There is not going to be one resource. There never will be. There's never going to be one human that's going to be the most amazing person that will teach you everything you need to know. So I actually don't like that question. Sorry. And I would say, I would say that the other tip I would give a younger self would be get Audible, because I love audiobooks. Read lots of books from different fields. Reach out to different mentors, even if you don't think you really like them, because even people you don't like, you're going to learn something from them. And humble yourself constantly. Don't act too big, and just constantly ask questions. So that's the resource. The life is the resource.
If you could go back in time and not do medicine, would you not do medicine then?
It's a great question. The hard part is there's never going to be a time where that happens, right? Hindsight's 20/20, and in this case, I won't know that. if you asked me that question during medical school, that answer would have been, get me the heck out of here. If I were to answer the question now, it's going to be crazy hard and it's going to be very difficult, but it's worth it in the end. Because the options and the opportunities of having the MD, the DO, and the ability to actually, understand how humans work, think, and function is invaluable. So
and that's what I wanted to kind of pull into, because you were mentioning about, you have these side projects and doing all this stuff, and it's invigorating your practice again. And I don't ever want people to physicians need to remember is all this training that we've gone through, all these experiences that we've gone through have served a purpose. And you can now apply them in new and different ways into new and different opportunities. And it's not going to hurt you. In fact, it's only going to benefit you. So, it's just funny because it's invigorating my practice and it's doing this and this, and you get excited, and we need to see more physicians that have that joy again. And so I that's where the change physician comes in, is find that avenue, find that passion, work it in, and optimize and pull in your physician experiences rather than regret them, I guess.
Yeah, I think the one thing that a lot of people might take for granted is, part of although it's very hard, you literally are training yourself to work harder than most humans ever will. And with a few exceptions, obviously, if you go in the military and those types of things, but you do have to gain a set of resiliency and a set of skills it's absolutely invaluable. There are very few humans that work as hard as physicians. And if you translate that into any other field, entrepreneurship, finance, any other creative field, you've already mastered or gotten close to learning a lot about something that's so difficult that confidence to know you can achieve that and then put that in something else, everything is just so much easier afterwards. I mean, I've never personally at this time, and knowing what I know about entrepreneurship and business, there's no concept of those skills that is harder than what I've learned in medicine. So that it is absolutely possible to grow all these multivariate skills in different places.
One question about, instead of not going to medical school, do you feel like you would have been, and this is kind of hard to say going back, but if you were to just do medical school and an internship and be a legitimate licensed physician without doing psychiatry, do you feel like you'd still be happy doing what you're doing and good for what you're doing?
I would, and it's funny you asked that, because I secretly, I'll just be honest, I had like an escape plan at multiple parts through this whole thing because it's hard.
You're
it's
not
really
the only
hard.
One.
So, I'm sure a lot of people listening, the same thing, like it's super hard. And when something is that hard, your mind needs to escape. I'll say now, every specialty has certain things that they learn, and that are valuable for them. Psychiatry is one interesting field because every person you interact with has a psyche, and every person you interact with has things that they're carrying behind the mind that you don't always see. I honestly feel like I'm like not a Jedi, but I've learned certain skills conversationally, and I've learned about the human condition, that those skills are so invaluable. Like me doing outpatient and working with patients of different mental disorders and diseases, you cannot, it's impossible to look into the future and say, I don't need to go into psychiatry. There's nothing I'm learning there. You only learn it in hindsight. And the skills I've learned, it's podcasting goes hand in hand with some, like a psychological field. Like there's no question there, but also in business, in negotiations, in relationships, in social situations and settings. When you go out, everything is a conversation. Everything is social skills. Everything is how we, I like to call it a dance, but how are we dancing together in this conversation? So those Jedi tricks or skills, it's truly invaluable. So I'm happy I've stuck to it. I'm happy I'm going through the process. So it's great.
Awesome. Yeah, that's awesome. Now, Dr. Brana, is there a particular location that people can find the work you do? Where would they go?
Yeah, so for the podcast, it's called the Happy Doc Podcast. I would say it's a compilation of guest episodes and short episodes about a wisdom, a quote, a truth. And my goal is to really inspire you to listen to either a guest or one of these episodes and have you think a little bit differently about how you can take action towards your potential, action towards your ability to achieve in life. So if that sounds like something that would be interesting to you, check out the Happy Doc. That's on all the podcast channels. Also for my medical students, and if you look further, there's going to be a lot more. We have a MedFlash Go podcast. That's medical flashcards on the go. And that's a podcast, short, quick questions that you can listen to. And if you just search MedFlash Go, it's a podcast. And we also have a software, an Alexa application for that as well.
Wow. Impressive. That's some good stuff. Well, I really appreciate you, Dr. Brana, for letting us interview you today and be part of the Change Physician podcast, because I do believe you are a change physician who is finding ways to create more fulfillment in your life, and redesigning the way you're living and practicing medicine. I'm sure this is going to continually evolve like it is for most of us. And I just want to thank you again. And the listeners, I'm sure, are going to get a few nuggets for sure, just from this brief conversation. So thank you very much.
Thank you. That was awesome.
All right. Y'all take care.